No one wants to think about their parents getting old. No one wants to think about their parents coming to the end of their lives. No one wants to think about getting one of those calls in the middle of the night and learning that your dad has just been admitted to the hospital. No one. Not even elder care professionals. But this is a story about real life and a real death. And it's told to us by two of agingparents.com's founding partners. Meet Carolyn Rosenblatt, a nurse and an attorney. And meet Dr. Nicole Davis, a psychologist specializing in helping families deal with the challenges of caring for aging loved ones. The story starts in the tranquil setting of a Hawaiian vacation, interrupted by a phone call to Dr. Davis about his father.
Carolyn and I were on vacation. We actually were on vacation in Hawaii. My sister was informing me that the next step was to have Dad hospitalized and that I probably needed to fly back from Hawaii. So we flew back to my parents in Southern California with my father getting up in his 80s. I think that what went through my mind was, this is what my worst nightmare. This is the call that I never wanted to get. I was hours and hours and hours away. I was across the ocean. I was so far distant, I couldn't just jump on a plane and be where my dad was in an hour or two, and was worried that, my father might die before I got to the hospital. I was fortunate that Carolyn was with me at the time, but we were trying to interpret through my sister, who was an emotional mess, what were the medical facts that were going on so that we could better understand the level of emergency that actually did exist.
His father was 89. He had been feeling poorly for a few months. Being a nurse, some of the telltale signs were there that made me feel intuitively that he might have cancer and that they hadn't found it yet. And when his sister told him that they thought it might be pancreatic cancer, the worst fears that I had for him were also realized. Nicole was really trying to calm his sister and remain in control of his emotions at the same time. When we saw his dad face to face, by this time they had in fact diagnosed the cancer. It was a matter of trying to support my husband because both his mother and his sister were leaning on him.
Now we're in the hospital, and we're in an area where both Carolyn and I have been writing about the challenges of dealing with the healthcare system. Now we're in the throes of the healthcare system, and we're dealing with doctors that aren't talking to nurses, and nurses that aren't talking to doctors, and technicians who aren't talking to any of those. And we're dealing with nurses that are floaters, that are from different countries, that are there just on a temporary basis for their 2 or 3 months working in the hospital. And now we're thrown into the middle of this amazingly broken, fragmented healthcare system, trying to get answers about whether or not my father's tumor that they diagnosed, which was next to the pancreas, was operable or not. And after a week and a half of tests and lots of challenges in trying to get people to communicate with one another, we finally got the best answer we could, which is that the doctor that was treating my father believed that if we could find the right surgeon, that my father at 89 was healthy enough that he probably could undergo some kind of surgery.
You're a nurse. You're a psychologist. You're talking to other like professionals who supposedly have the facts in front of them, and yet you're telling me it took a week in order to get any clarity or communication that made sense. Were you having to yell at people? Were you having to wave threatening documents? Were you having to corral people in the hallway and say, listen up, I'm here, we've been here for a number of days, tell me what's going on?
We had to do all of that.
Yeah.
We actually had to do all of that. The thing that we found the most irritating is that the doctors would do their rounds at around 7:30 in the morning. And when they would do their rounds, then after they did their rounds, they'd write their orders. And their orders were frequently to do different kinds of tests. And then in order for the tests to happen, even if they were tests that were urgent, that then the tests had to be coordinated with the transportation in the hospital, which was the people that would move my father by wheelchair to whatever facility that would do the diagnostic tests. And that once the tests were done, then the report would have to happen from the diagnostician, and then it'd have to be read by the doctor. And what we found is that frequently tests would be ordered, and at the end of the day, I would have been asking every 15 minutes, when are they going to move my dad for the tests? And they would say the orders haven't been written by the doctor, so we can't do the tests until they are. Then when the orders were written, I would ask, okay, now the orders are written, how come the tests aren't being completed? Oh, we have to wait for transportation. And at one point, I put my father in a wheelchair and was ready to wheel him downstairs to the various places to get tested because I lost patience with the whole process. Then once the test was done, the doctors couldn't do anything until the diagnostician that did the test would have to do their report. And so meanwhile, my concern was, my father's going to die while we're waiting for someone to pass on the information, which we found from our experience, often the information doesn't get passed on. And furthermore, when any kind of treatment was ordered for my father, we also experienced that one nursing shift wouldn't communicate to the other nursing shift. So we would come in and they would be wanting to give my father certain medications, which they had discontinued the previous shift, but it hadn't been communicated. So it was just an amazing nightmare, and the good fortune for my father and the blessing for me in my life was I had a wife that was able to continue to be working 500 miles away, and I just stopped my practice. I stopped my business, I stopped seeing patients, and I just decided that I was just going to stay in the hospital. My father was so scared about what was going on and that they were going to make mistakes, which it was so clear that they were going to be making, that my dad needed an advocate. So I became my father's full-time advocate.
I'm imagining that your wife provided some counsel to you on the phone.
She certainly did.
Carolyn, tell me about some of the calls that you got from Nicole.
First of all, this was very frustrating for everyone. This was a hospital in Southern California, which shall remain nameless, which touts itself as one of the finest in the country.
Number 3 in the nation.
And this was the best and brightest people available to provide health care. It wasn't lack of good intention, it was lack of communication. It was the constant changeover of staff. It was the disconnect between one specialist and another. Remember, this was an 89-year-old man, and they wanted to be sure if they were contemplating surgery, which they were, that he could withstand the surgery. The surgery had a lot of risks, and I knew that there were a lot of risks. I also knew that there were a lot of things that could go wrong before such surgery might take place. And because he had been married to Nicole's mom for 62 years, there was a tremendous upheaval emotionally for both of them. He didn't want to die and leave her. She didn't want to lose her husband and companion of that length of time, and they loved each other very much. And the other sibling was distraught beyond words. It was a very hard time. As an in-law, one has to be careful. You can't push your way through it all, no matter whether you know things they don't know because of professional experience or not.
But you did know things.
I did know things.
And I imagine some of the things that you knew is that you weren't surprised about anything that was happening.
I wasn't, and I was a little surprised that they elected to do the surgery, but I understood why they made that choice. The alternative wasn't very good. His father had pancreatic cancer. The prognosis is not good. People who have surgery and survive it, if they don't get all of the cancer cells, don't have a good outcome. There was hope that they would be able to excise the tumor, take it out, and that he would be okay with some chemotherapy. But he underwent the surgery having passed all of the screening criteria, and I knew that just because he got through the surgery alive didn't mean that he would make it.
But in the distance between you and Nicole and the situation going in Southern California and you being in Northern California, what could you actually do?
It was very hard. I was flying back and forth. Sometimes I would be there for a few days and then come back. Somebody had to tend to the business of our own lives. So I could really be phone support for my husband mainly. I never spoke with my mother-in-law. I never spoke with my sister-in-law. Neither of them could take in any more information, especially information that might be contrary to what they wanted to believe.
Did you speak to any of the professionals in the hospital?
When I was present. And his father underwent the surgery and within 3 days had developed the complications that everyone didn't want him to have. And he began a very rapid downhill course from that point. I knew that the chances of a good outcome were very small. He was getting worse by the day. It was my job to support my husband and help him cope with this reality that everyone could see, but no one was articulating.